Avoiding deadly hospital infections, a must-watch guide. Hello healthcare professionals. Today I'm diving into a crucial topic, healthcare-associated infections or HAIs. These infections are serious, often developing 48 hours or more after hospital admission or within 30 days of receiving healthcare services. They can extend hospital stays, increase medical costs, and lead to life-threatening complications. Let's dive into some common HAIs and how to prevent them. First up, catheter-associated urinary tract infections, or CAUTIs. These occur when bacteria enter the urinary tract through a catheter. Imagine a 75-year-old male patient post-surgery with a catheter. After several days, he develops symptoms of a urinary tract infection like fever and painful urination. Lab results confirm a bacterial infection. To prevent CAUTIs, only use catheters when absolutely necessary, ensure proper hygiene, and remove the catheter as soon as possible. Next, central line-associated bloodstream infections, or CLABSIS. These infections occur when bacteria enter the bloodstream through a central line. Picture a patient in the ICU requiring long-term intravenous medication. Improper care of the central line site leads to contamination, causing a serious bloodstream infection. To prevent CLABSIS, follow strict sterile protocols, regularly clean the catheter site, and remove central lines as soon as they're no longer needed. Now let's talk about surgical site infections, or SSIs. These occur at the site of surgery. Consider a woman who undergoes a cesarean section. A week later, she notices redness, swelling, and discharge around the incision. Her physician diagnoses an SSI, likely due to bacteria introduced during surgery. To prevent SSIs, ensure proper hand hygiene, use sterile surgical techniques, administer prophylactic antibiotics, and educate patients on post-operative wound care. Ventilator-associated pneumonia, or VAP, is another HAI. This type of pneumonia occurs in patients using mechanical ventilators. Imagine a 60-year-old patient with severe pneumonia placed on a ventilator. After 5 days, his condition worsens and X-rays confirm VAP. To prevent VAP, follow strict hand hygiene and ventilation protocols, elevate the head of the bed, and regularly assess the need for ventilation. Clostridioids. Difficile infections, or CDIs, are caused by the bacterium. They often follow antibiotic use, which disrupts normal gut flora. Think of a 55-year-old woman treated with broad-spectrum antibiotics who then experiences severe diarrhea. Lab tests confirm CDI. To prevent CDIs, use antibiotics judiciously, isolate patients with CDI, and implement strict cleaning protocols. Methicillin-resistant Staphylococcus aureus, or MRSA, is resistant to many antibiotics. Consider a diabetic patient with a foot ulcer that becomes infected with MRSA. To prevent MRSA, follow strict hand hygiene, screen high-risk patients, and properly clean and disinfect surfaces. Finally, gastrointestinal infections in healthcare settings are often caused by pathogens like OR. Picture a nursing home outbreak due to contaminated surfaces. To prevent these infections, enforce strict hand hygiene, ensure proper food handling, and regularly disinfect surfaces. Key takeaways. Regular hand washing is the most effective way to prevent HAIs. Minimize the use of invasive devices and ensure sterile techniques. Follow strict infection control protocols, including isolation and disinfection. Use antibiotics carefully to prevent resistant infections. Each type of HAI requires tailored prevention strategies and vigilance to minimize its impact on patient safety and healthcare outcomes. Thanks for watching and stay safe.